Nutritional assessment. Nutritional problem is one of the major problem in our country. So major health problem. The nutritional assessment will be helpful to prevent the yearly health problem, identify the diseases in yearly. In this class we have to see A, B, C, D, E, F of nutritional assessment. So what is A? A is called the anthropometric measurement. It is one of the very quick and easiest method and cheap method we can use. It is a simple method of this one. What is B? B is a biochemical test which we are using, assessing by the biochemical chemicals which will be assessing by our blood and urine and tissue. We can find out what are all the nutritional problem. C is called the clinical assessment. D is called the dietary assessment. E is the ecological factor. F is a functional assessment. First is anthropometric measurement. Is the Gomez classification is a very much important one. For the infant, we have count the actual weight, expected weight into 100. This is the formula for actual weight for the infant. Age in month divided by 2 in plus 9 is the expected weight will be coming. This is the calculation for expected weight. When you put that expected weight, actual weight you can calculate. This is the formula for 1 to 6 year baby and 7 to 12 year baby. 1 to 6 year baby age in year into 2 plus 8. 7 to 12 year age in years into 7 minus 5 divided by 2. So these are all the expected weight which is the Gomez classification, and you can take the actual weight, and once this is coming with the range you can divide into normal, what is the level, and mild malnutrition, moderate malnutrition and severe malnutrition. Malnutrition is a very important one. This is the Gomez classification we can follow. We can do for adult what we can do, like a BMI, underweight or normal weight, age in year, height in meter square divided by height in meter square. So if it is less than 18.5, it's underweight. Normal is 18.5 to 24.9. Overweight is 25 to 29.9. Obesity class 1 30 to 34.9. Obesity 2 will be 35 to 39.9. Third will be this above 40 will be called the morbid obesity. B. B is a biochemical test. This test mainly done by the blood, urine and tissues. Mainly will be in the blood, there will be serum protein level, and then serum vitamin A, carotene, serum carotene, and the serum alkaline will be checked, phosphate will be checked for the vitamin D deficiency, serum ascorbic acid done it for the ascorbic acid deficiency, and the urinary thiamine for the thiamine test, urinary riboflavin to check the riboflavin deficiency, and urinary N-methylniacin, for that they are checking the mycophenolate we are telling, and HB blood smear hematocrit value will be checked for the iron deficiency anemia. T3, T4, TSH will be the iodine deficiency. We can make it out. This one hormonal deficiency or one nutritional metabolic disorder will be having a direct or indirect effect upon the other disorders. So it's better to yearly diagnosis, yearly assessment. The nurses have to have a high knowledge regarding finding out the clinical signs and symptoms. So the clinical signs and symptoms, which is what you can see by your own eyes, by the edema or diarrhea, poor appetite or sclera, you can find out. Conjunctiva, what is the color, or the spoon shaped nail, we can find out. Bleeding gums, scurvy, bite or spot, vitamin A, angular stomatitis, riboflavin deficiency. Knock-knee, bowlegs will be vitamin D deficiency. Mottled dental will be the excessive fluoride which is present. Excessive fluorine is necessary, but excessive fluorine will be the deposition of the color. And then the spoon shaped nail will be the iron deficiency. Sometimes you drink continuously with salt water, it may end up with a cardiac problem also. Next, if you see the dietary assessment is very important. Dietary assessment you can do as a direct assessment, indirect assessment, innovative technologies and prospective technology. Direct assessment, directly you can ask the history, like what they are eating from 6 hours, 24-hour recall, 6 o'clock to the next to 6 o'clock, and direct history, and the food frequency questionnaire can be useful, how they are using, what staple food there. One village I go there, I just ask them what is their dietary history, what do you eat every day. They eat in the West Bengal. They eat rice and not even a dal. Sometimes they eat the dal and the aloo, rice and aloo. Not even a single green leaves available. No village. The water from that area is very poor, and they go long area to get the only one water pump is there. They are taking that drinking water. No electricity also there. From the pond they are taking water. So these are all the frequent questions will be tell suppose what kind of a thing they are eating, and then indications of the dietary quality is very important, and they'll screen us. You can screen them. And the innovative technology, like now we have a personal digital appliance, like a digital mobile. There is a app is available that will be assessing you, that will give you alarm. AI technology has been implemented to assess you how long you have walked. You are sitting so long, sometimes your sleeping time has come, you have to walk, you have to drink water. So innovative web-based technologies are there. With that technology, some doctors also will be consulting monthly 3,000 you are paying app plus doctor consultation. So like that, innovative technologies, watches, scan-based technologies are coming. So then this another innovative technology, prospective, estimated the food record and weighing the food record and duplicate the diet model, everything. Indirect method, use the use the secondary informations like the food supply, what's available, locally available food, what they are doing, agriculture statistics, how the food is coming from, where the food, and how much amount they will be spent for their expenditure, household expenditure survey, and the food balance sheet, what they are doing. So you can see what they are eating, continuously using what kind of oil, if that oil is having any side effects, or it's a polysaturated oil or the poly unsaturated oil which is good for them. We can find out what is the why the disease has come. We can correlate with very clinical signs and symptoms with their history. When you say the clinical signs and symptoms, you can relate with another one. F is called the you haven't seen the E, no? The ecological assessment. You can ask me what is the ecology is the main reason, because we used to consume what is the food which has been cultivated. You can see that this Himalayan belt region, so many people, women were suffering from the goiter. They tested that the soil, they saw that the soil do not have the iodine. So when they eat the food which is coming cultivated from the Himalayan belt, all women are having. So what the intervention has done, the mass high intervention done by this iodized salts applied to the Himalayan region people, slowly there is a reduction of the goiter problem in this one. So the atmosphere have a greater influence. For example, if you take the atmosphere, if you see the Delhi people, one of 1993 itself, my friend's mother, when she is having asthmatic patients, the Delhi climate and the pollution, she immediately died within 1 year of survey. 1 year she couldn't survey in the Delhi. So atmosphere having the influence of this location where there the soil will be this one, and the harvest and the food chain. Continuously they are harvesting, or continuously they eat aloo or something continuously, which is a production. So they are not moving, and the logistics is not available, or the road may not be there. This is isolated village, only they are eating. So what kind of this one, all these history collection will be helpful to you, the assess. So all matters of the nutritional deficiency, what they are going to get it. So what the deficiency get it, you can collect the history. Functional assessment, very well you know, functional deficit mainly due to the nutritional, 99% is functional deficiency due to the nutritional intake. Either the nutritional intake is less, or the nutritional absorption, there is a problem in the secondary illness, you can say. But if you see the eye function is reducing, surely there is a vitamin D A deficiency. Bone problem, vitamin D deficiency. Thyroid function will be iodine or edema, or the protein maybe protein, excessive protein they are taking, or there is a kidney, it's a problem, either excreting the protein, means another problem is there. So the slow clotting, vitamin K deficiency, tetany, estimation of the protein, you can do chelosis, vitamin C, angular stomatitis, delayed wound healing, vitamin C, calcium deficiency, all will be causing this one. So this is the functions will be affected. So this is the functional assessment. Clinical assessment with the help of the clinical signs and symptoms, like how you are doing it. So this is about the nutritional assessment is one of the important one. Nurses from the nurses has to teach the Anganwadi Balwadi workers also. So the nutritional deficiency should be cured in the Anganwadi Palwadi. Small under 5 children is also mostly affected, and also the women is mostly affected. The women's health is better, then the whole family health will be better. It is the role of the nurse has to assess. So wherever you go to the community, please follow the adult, you follow this formula, and the children please follow the Gomez classification and educate them to assess their own health conditions to prevent the disorder. So where health is a wealth. Thank you.